Hi, my name's Kylea Potvin, and I'm an oncologist. What that means is I treat cancer, and it's an incredibly rewarding job. I have to give you some great news, which is that we are in fact curing more cancers, and we're helping people even with incurable cancers to live longer, much more rewarding lives. And that's because of the great work from brilliant scientists out there who are helping us understand this disease better, not only how it happens, but how we can actually treat it better. The difficulty is there is a challenge with this kind of innovation, and the challenges are many, but one of the significant ones that is facing us immediately is how we're going to get these new treatments to patients. We're really blessed here in Canada that we live in a publicly funded healthcare system and our tax dollars are really put to good work. But the difficulty is that fund is limited. There are a lot of things that need to be funded in our healthcare system, and though our government is doing its best, not everything can be funded at all times for all people. I'd like to tell you about a story that created ACT Now. This is about a wonderful patient of mine, a beautiful 32-year-old young woman who is enjoying health and a new 8-month-old baby with her family. This young woman had a lump in her breast that everyone assumed was an infection, which would have made sense in a woman at her age. But unfortunately, the lump didn't respond, and ultimately, it was found out that she had a very rare and very aggressive form of breast cancer. I was lucky to work with a team of other really caring physicians, and everything that we did, surgery, radiation, the normal drug treatments for most breast cancers, nothing worked for this young woman. I wanted to try a different drug. It wasn't to cure this woman, but my goal was to try to relieve her pain, control her cancer, and get her out of the hospital so she could be home and to hold her son again, because these were things she couldn't do. I lobbied the government, I lobbied the drug company, everyone we could think of. Her family worked at fundraising as hard as they could. Finally, the day her husband came to our hospital with the money to pay for her first treatment was the day this woman died. I can't tell you how helpless I felt at that time, being her doctor, treating her, knowing there was a drug I wanted, and the simple barrier to giving it to her was money. So that's when I decided, and with the help of many wonderful supportive people, I started ACT Now for Cancer. This is a fund that's to help our patients in London who are going through cancer treatment at our center. We're here to help try to cover some of the costs of the supportive medications, but also of some of the new agents, new treatments that are coming out that just can't be funded for everybody. But ACT Now couldn't happen by my wishes or desires alone. I'm very grateful to the support of the volunteers who've been giving me their endless hours and effort, and to the donors who have already helped ACT Now become a reality. Thanks to what's happened thus far, we're already helping patients in our center receive the treatments that they're needing and improving their lives. But the job doesn't stop there. We need you, people like you. You've come to this website, you're watching this video for a reason, because you care about what happens to people with cancer. And the reality is, all of us have been touched by it. All of us may be touched by it in the future. So please explore this website to understand more about what ACT Now is about and who it's helping. But also please explore to see how you can help. As a doctor, I don't see my job simply to treat patients. I also know that I'm here to be an advocate for the well-being and needs of those patients I serve. By you supporting ACT Now, you also become an advocate for those people here in our community that need your help. Even the smallest donation can make a big difference. On behalf of the patients, their families, and caregivers, I thank you. You've made our community stronger.